For social, personal, and in rare cases medical reasons, many women are choosing not to breastfeed their newborn infants, regardless of the multitude of research that continues to prove that, upon review of both short and long-term health outcomes for mom and babe, breastfeeding is far superior to its unnatural counterparts. The following video is intended to be viewed by expectant mothers and growing families. The goal is to provide an overview of the most significant benefits of breastfeeding for both mom and babe in an effort to empower more women to choose to exclusively breastfeed their newborn infants and to educate women who choose not to breastfeed their infants, whether for social, personal, or medical reasons, so that they may make an informed decision not to do so. The Infant Feeding Joint Working Group, a collaboration between Health Canada and other national organizations, suggests that breastfeeding exclusively for the first 6 months of life and sustained breastfeeding up to 2 years or older with appropriate complementary feedings is an ideal form of infant nutrition. Now let's have a look at 5 benefits of breastfeeding for you. First, breastfeeding stimulates the release of the hormone oxytocin. This promotes contraction of the uterus, encouraging it to return to its pre-pregnancy size, thereby reducing the risk of postpartum hemorrhage or excessive bleeding post-delivery. Additionally, breastfeeding exclusively and regularly every 2 to 3 hours around the clock delays ovulation, preventing the return of menstruation and thereby acting as one form of birth control. This is the body's way of encouraging natural child spacing, i.e. preventing you from becoming pregnant while your body takes time to recover. However, this is not 100% effective, so please do consider other options for contraception. During pregnancy, your body stores excess fat in preparation for having to support both mother and child in the postpartum period. Naturally, your body expects to use this stored energy to nourish your baby. The average woman expels 480 calories per day by breastfeeding alone. Meanwhile, women who choose not to breastfeed must find alternative ways to work off the excess weight gained in pregnancy. Studies show that women who exclusively breastfeed return to their pre-pregnancy weight faster than their non-breastfeeding counterparts. Additionally, women who breastfeed carry a reduced risk of developing type 2 diabetes, hypertension, cardiovascular disease, and rheumatoid arthritis. And finally, women who breastfeed carry a reduced risk of developing breast and ovarian cancers. This is due to a reduction of estrogen during lactation. Therefore, the longer you breastfeed, the lower your risk of developing these cancers. Now let's have a look at the 5 benefits of breastfeeding for baby. First, the physical closeness, skin to skin and eye contact during breastfeeding help to further develop the bond between mom and babe. Second, breast milk is specifically tailored to your individual baby. It presents a perfect mix of nutrients, fats, and proteins, and the quantity is created in response to stimulation of the breast each time baby feeds. This meaning that once your milk has come in, your body will make exactly the perfect composition and amount of breast milk to support your growing baby's needs. Additionally, not only does breast milk itself contain protective properties such as antibodies to help baby fight off harmful viruses and bacteria, breastfeeding has also been proven to enhance the effectiveness of certain vaccines, providing enhanced lifelong immunity. Additionally, breastfed babies have a reduced risk of developing the following diseases and illnesses, such as GI infections, celiac disease, asthma, eczema, respiratory tract infections, ear infections, adolescent and adult obesity, type 1 and 2 diabetes, and certain childhood cancers such as ALL and AML. And finally, breastfed babies are 50% less likely to develop SIDS, sudden infant death syndrome. It is my hope that you will consider the information from this video, review current guidelines provided by organizations such as Health Canada nationally and the World Health Organization internationally. Consider current research, ask your primary care provider for more information, and educate yourself to make a responsible decision about which form of infant nutrition is best for you and your growing family. Happy reading!